Heart disease remains the leading cause of death in the United States, claiming one life every 34 seconds. But a new study suggests some of the most powerful protection are things we are very familiar with: sleep, physical activity, and nutrition. Dr. Samir Waheed is an interventional cardiologist with Heart Hospital of Austin. We appreciate you being here, Dr. Waheed.
Thanks for having me.
Yeah, absolutely. All right, so there have been heart disease studies, right? Plenty of them looking at sleep, physical activity, nutrition. This one actually looks at all three. Why is that significant?
So this is a very important study that was done primarily by researchers in the United Kingdom and in Australia. The benefit of this is we know the individual lifestyle factors which reduce the risk of heart attacks, strokes, and heart failure. But this is one study which combines all of them and looks statistical significance to see whether changes in all three pillars would have a synergistic effect or a multiplicative effect on the patient's risk factors of having these conditions.
Yeah, so what did we find? We looked at, what, 53,000 people, and what was the result?
So the total number of patients were followed were close to 55,000. Okay. They were followed over a span of 8 years. And what we observed was their sleeping patterns, the number of hours of sleep they got, their physical activity, and also they were scored from 0 to 100 based on their diet quality, whether that includes fruits and vegetables or not. When we follow these patients for 8 years, it lets us determine what is their risk of heart attack, stroke, and development of heart failure in this observational period of 8 years. The average age of these patients was close to 65 years. 58% of them were men, and the remaining were women. So there was a pretty good distribution of the gender in this study, and we had some very significant findings from this.
Talk about the significant findings, please.
So what we found was, we have been told, and this is still true, that moderate or vigorous physical exercise, at least 30 minutes a day, most days of the week, has a benefit. Sleep, the general recommendation was 7 to 9 hours for adults. And then dietary habits, of course, including at least 5 servings of fruits and vegetables. Now, in day-to-day practice, these targets are hard to meet by patients because it feels like they have to make drastic changes to their lifestyle in multiple areas. This study looked to see whether there is a dose-related relationship between these individual components and the outcomes. And what we found was as little as increasing your sleep duration by 10 minutes on average, or increasing your physical activity by just 5 minutes, or just getting a quarter cup of vegetables in a day can actually reduce your risk of heart attack, stroke, or heart failure development by 10%.
That's amazing, right? 10, 11 minutes of extra sleep. And this is every day, not every week, right?
Yes,
and you said or, so not all three activities, just one or the other, right?
Well, the importance of this study is that if you do all three of them combined in smaller amounts, which is very achievable by our common patients, the benefit is more than one pillar combined in much greater amount. For example, increasing sleep by 10 minutes will give you this benefit if you combine it with a little bit physical activity and diet. But if you just want to get the benefit from sleep alone, you have to put 3 times additional minutes compared to doing all three of them together.
Gotcha.
Yes.
Well, the study I think you mentioned was done in England, UK, Australia. Does that make a difference for Americans?
It does not make a difference because we're still looking at a population primarily from the first world developed countries. The lifestyle are not much different.
Okay.
The usual risk factors of diabetes, smoking, obesity, they were equalized among the patient population. And it was a pretty large cohort of patients that they studied. So it does carry the same significance, in my opinion, across the pond.
Another piece of good news, people can start doing this right now, right?
Yes, that's very important. Like the study suggests, that minor changes, 5 minutes of more activity, this can be something as simple as taking a flight of stairs a couple times a day at work, or parking a little bit further away from your workplace so you can put in those extra 5 minutes of work time, moderate activity, and just a quarter cup of fresh vegetables in your food and just 10 minutes of extra sleep. It is achievable. So the takeaway message for the patients is that the healthcare prevention is like a stool, or like a 3-legged stool that we are sitting on. If all 3 of them are in somewhat of an acceptable shape, it will do its job. But if you focus on only one, but the other 2 are missing, that's not a good sitting position.
You're going to fall off that stool.
Exactly.
All right, Dr. Waheed, thank you so much for joining us, Samir Waheed, with all that knowledge. So go out, walk a little bit extra, sleep a little bit extra, eat some more vegetables.
Exactly.
All right.
Yeah.